You're listening to Be Health Connected, a podcast by the St. Louis Area Business Health Coalition. Your host for today's episode is Annie Fitzgerald, BHC Wellbeing and Member Services Coordinator.
Hello, my name is Annie Fitzgerald, and welcome back to the BHC's Be Health Connected podcast. In this episode, we revisit our conversation around type 2 diabetes, specifically employer efforts to prevent the condition in their workplace. An estimated 96 million U.S. adults, which is greater than 1 in 3, have prediabetes. With prediabetes, blood sugar is higher than normal, but not high enough yet to be diagnosed as diabetes. People with diabetes are at high risk for comorbid conditions such as heart disease and stroke. The National Diabetes Prevention Program, also known as the National DPP, is an evidence-based lifestyle change program that is proven to prevent or delay type 2 diabetes in adults. People with prediabetes who take part in this structured lifestyle change program can reduce their risk of developing type 2 diabetes by up to 58% and up to 71% for people over 60 years old. To better understand the value of the National Diabetes Prevention Program from an employer perspective, I am joined by Angie Kapp, Senior Manager of Benefits with Toyoda Gosei. Angie, thanks so much for taking the time to join us today.
Thank you so much for having me. I'm very happy to be here today.
So for the listeners who aren't familiar, can you talk a little bit about Toyoda Gosei, talk about what you do and a little about your workforce?
Sure. As you said, my name is Angie Kapp. I am the Senior Manager of Benefits for Toyoda Gosei. I am over benefits, wellness, and leave of absence. And for those of you not familiar with Toyoda Gosei, we are Toyoda Gosei North America. We are an automobile parts manufacturer. We make parts for almost every brand of vehicle that you can think of. Everything from safety systems parts such as airbags and inflators, interior, exterior parts, dashboards, grills, consoles, automotive sealing, and also we have a chrome division, so chroming pieces such as dashes and grills. We have about 5,000 full-time employees, which equates to about 8,000 to 9,000 covered lives in our United States locations. We have 11 locations in the United States, 7 across 7 states. And the North America Corporation also has plants in Canada and Mexico. Our largest population is production workers, but we also have a large amount of engineers, sales, production support, such as purchasing and shipping, management and corporate administration at each location. Most of our employees are full-time, and we have quite a few team members whose spouse works for us. In some cases, their adult children do as well. So large population.
Well, very cool. I mean, I think that's a testament to having a good culture of health, that you've got the whole family working for TG. So can you talk a little bit about your organization's approach to employee health, and maybe a little bit about how the National Diabetes Prevention Program fits in within this strategy?
Absolutely. We know that wellness overall is a win-win for both us as a company and for our team members. For the team members, it's better quality of life and lower healthcare costs. For employers, it leads to better engagement, higher production, and lower healthcare costs for us too as a company. We started our wellness program in 2017. The employee was given an incentive or a surcharge to their healthcare premium, depending on their participation in our wellness program. So the details of the program combine basically biometric screenings, getting those screenings to your healthcare provider, and then participating in healthy activities such as walking challenges. And since spouses are such a large cost to our insurance overall, the covered spouses on the plan were included too. In 2020, we switched to a new provider that was in the United Healthcare ecosystem, which made it even easier for our employees to participate in the program. Of the list of activities employees could complete, we highly incentivize the wellness visit, since that is the goal of the program. We really wanted those employees to go to the doctor to find out what conditions they have, and then get those addressed, any issues that they may have addressed before it turned into a serious health condition and a high cost claim. And as far as the National Diabetes Prevention Program, my background before coming to TG included over 20 years of medical practice management, so I've been aware of the program for quite a while. We were initially aware of how many of our team members fell into either the diabetes or the prediabetes category from our wellness program results. So when I came to TG in 2018, we really started digging into the cost drivers and our claims experience and looking at our population health overall to find out what the drivers were. And then we started looking at programs to start addressing all of those issues. So late in 2019, we started Livongo for diabetes and hypertension management. It included free testing supplies, and we really encouraged the employee to stay on top of their conditions. We also added Real Appeal, which is a free weight loss program. In 2021, our second highest spend across medical and pharmacy as a category was diabetes and its related conditions. To address this even further, we added Virta in 2022, which is a diabetic reversal program that's more intensive of a coaching program for those that really truly wanted to lower their A1C and look at potentially also lowering their costs by either reducing or eliminating their need for diabetic medications through healthier habits and nutrition.
You know, with such a comprehensive diabetes prevention and management and reversal strategy, did you have to, bring any specific talking points to your senior leadership to approve of, using the National Diabetes Prevention Program?
All of our decisions regarding our healthcare strategy are extremely data-driven. So when you really took a deep dive, like I said, into the population health and looked at our claim spend and looked at the results of everything from our wellness programs and the conditions that were identified, new conditions that were identified, people that weren't aware that they were maybe in that pre-diabetic level or that their BMI was out of control and they didn't necessarily realize just how out of control it was. So the conditions, once we looked at that and presented that data to our senior leadership of the conditions that were identified in the wellness programs and just how many of our team members were either affected by diabetes or anything that goes along with it, the hypertension, the overweight, all of those sorts of things, that the data really told the story for us and sold it for us as to why we needed to do something for our population.
And then, from an employee perspective, did you have any specific communications or engagement strategies that you found to be particularly successful to encourage participation in the National DPP?
We have a lot of communication channels where we reach our employees because we have so many differing areas where our employees work and level of technology across our employee base. So we use a lot of the traditional methods of mailers to the employee's home. We send out emails to those that have company email addresses. We use start a shift communications on the production floor to talk about any new initiatives or any ongoing initiatives or things like that. We use the quarterly employee meetings that we have. We always take about 5 or 10 minutes to address anything benefits related. In that, we have weekly announcements that I keep updated with anything that's going on with benefits. We also have TGTVs in all the plants, and it's basically a TV screen that allows us just to scroll any kind of healthcare information that we need to get out to the employees. In early 2020, we started a benefits website, and it is a one-stop shop for our team members to find everything related to their healthcare benefits and programs. Anything from the cost to contact information to flyers on the programs to how to enroll in the programs. We wanted to pretty much break down any kind of barrier any employee would have to either finding out the information or accessing the information or reaching the benefits team. So we made the website something that was very easy to remember. We added an email with the same name, so it was easy for the employees to remember how to email us with any questions that they may have and reach us very quickly. We have an app called My Smart Contacts that the employee can download to their phone that gives them one-click access to either the phone number to the vendor or to the website. In 2021, we know how branding is so important with any type of initiative like this. So in 2021, we branded our wellness program #TG HealthyMe, and everything related to our wellness program goes out with that branding on it. It has the same look, it has the same name, so it's very easy for employees to recognize that this is something related to my benefits. Quarterly, we started monthly email. We put together a calendar at the beginning of the year as to what we want to talk about each month. We send that monthly email out from that benefits email address. So once again, it's easily recognizable from the employee. And then quarterly, we combine all of those emails into a newsletter that gets mailed to all of the employees' homes so that we are also reaching all of those employees that do not have a company email address. For programs specifically like Virta, Livongo, some of our other wellness programs, we have communication plans with those too, that we regularly send out either mailers or emails.
I mean, I am just so impressed with the comprehensive communications strategy that you have in place, not only for the National DPP, but also your well-being program in general. From the BHC's perspective and our conversation with employers, we found that a big struggle for some employers that are trying to implement the National DPP program is, communicating about the program and getting engagement and recruiting participation in the program. And so, I think, TG is such a great example of having a strategy that really reaches all employees, whether or not they're working in an office or, as you said, working in a plant or, the various different environments. So really commend you on that comprehensive strategy. How has the program so far been received by participants that are engaging with the program? Can you share some of the program outcomes that you've seen to date?
I do. We have the program availability is really for anybody that is on our TG Healthcare plan. And we have a lot of those wellness programs that are no cost to our employee. We know that, as you kind of mentioned it in the beginning, that diabetes, there's so many comorbidities that go along with that. So we really try to address that whole universe of things that can happen. So we have Rally as our general wellness program. Virta is our diabetic reversal program. We have Livongo for diabetes and hypertension management. We have Real Appeal as a free weight loss program. We have Sword Health for virtual physical therapy. Quit for Life is our smoking cessation program, since a lot of times that can kind of lead into things as well. And because we know how behavioral health actually can really play a role in your overall condition and your healthiness, we have our Optum Employee Assistance Program. We have Sanvello as a mindfulness app, and then we actually have Talkspace for virtual behavioral emotional health therapy. All of these programs are free for our employees, except for Talkspace, but that's covered underneath our United Healthcare plan. We have had some great feedback from our employees on the various programs. When you look at the metrics or the outcomes, we've seen an increase of 26% in controlled diabetes from baseline to 6 months in the program on Livongo. We have seen a shift of 7% of employees that started out in either stage 1 or stage 2 hypertension and moved down into a controlled status. Our Virta program was just rolled out, but we've gotten some really good engagement and some very positive feedback from our employees that say they have already seen great changes in their blood glucose and in their weight, and just general knowledge that they've gained about nutrition that they didn't know, didn't realize, things that, hey, I can really eat normal foods and make myself healthier. I don't have to completely turn my lifestyle on end to be able to gain a healthier state when it comes to diabetes. We've also had really good participation, including a rock star in Missouri that lost over 100 pounds in Real Appeal, which is our weight loss program. So we've had some really good results so far, hoping to drive some more engagement and even better results.
Always hoping for, more engagement and better results. So agree with you there. If you were to give any advice to an employer who is interested in offering the National Diabetes Prevention Lifestyle Change Program, what would you say to them?
Get involved. Number one, get involved. We have seen such good results from what we've done here at TG. And I really am hopeful that we can continue to affect that positive change in our workforce, both for the employees and for the company. Healthy employees equal healthy company, right? But really look at your data. Roll out programs that specifically address your employee base needs. Population health is very, very important for your specific demographic. And it's very, very important in paying attention to that, to have a successful benefit strategy, both for your company and for your people. And then communication is absolutely the key. Find out what channels your employees best receive information and deliver it there, wherever that may be. And that may lead to the 10 different channels like we have, but that's what you have to do to reach your employees. Communicate it again and again and again. You have to receive a message 3 times before you get it, right? But really communicate in every way possible so that when your people need the information, they know right away where to go to access it easily and get involved themselves.
No, I couldn't agree more. Again, super impressed with your current communication strategy and agree that other employers, when they're trying to encourage participation in their programs, take a look at how you're communicating the program and make sure that that's actually, meeting the needs of what your employees are looking for and how they like to receive information. So agree, that's great advice. What is next for TG's diabetes prevention strategy? Do you have anything in the works?
We are going to absolutely continue to focus on wellness. We're going to absolutely to communicate everything we can about these free programs that we have for our employees, and do anything we can to encourage the participation there. We are anticipating even better outcomes with our diabetic population with the addition of Virta for them. So we're looking forward to getting long enough into that program that we really start seeing some results. And of course, we're going to be taking a deeper dive into our data to make sure that our programs are effective. We're going to adjust as needed and continue to do our best to meet our people where they are on their health journey so that we can help them.
Well, Angie, we have so appreciated your time today and really look forward to following Toyoda Gosei's story as you continue to try and promote diabetes prevention among your employees and their families. For any employers who are listening, if you'd like more information about coverage options for the National Diabetes Prevention Program, you can visit www.coveragetoolkit.org for a wealth of resources and connections to other employers that are currently covering the program or are interested in covering the program. So, Angie, once again, thank you so much for joining us today and look forward to following TG's story.
Annie, thank you so much for having me. Have a great day.
Thank you for listening to the Be Health Connected podcast. For additional episodes or to learn more about employer resources available through the St. Louis Area Business Health Coalition, please visit www.stlbhc.org.